What is a coronavirus? COVID-19 is a coronavirus, which implies almost no to a great many people who don't work in virology or immunology. A coronavirus is a gathering of infections that can taint warm-blooded animals and birds. 1. In people, they can cause respiratory tract contaminations, a significant number of which can be treated with over-the-counter prescription. The purported basic cold is the after effect of a coronavirus. And keeping in mind that most are surely known and seldom in excess of a bother, some can be deadly. COVID-19 alludes to the episode of the sickness, which is separated as coronavirus disease 2019. The infection itself additionally has a name, yet it's somewhat of a significant piece: severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2. Some portion of that abbreviation might be natural, seeing as the world previously experienced a comparative flare-up of SARS in 2003. 2. The infections are connected, and it wouldn't be not feasible to call this new flare-up SARS 2.0. 3. However, you likely won't hear any expert virologists state that in the media. In any case, COVID-19 is a coronavirus, and it is spreading, yet that is not a reason to worry. Rather, it's a reason to plan and ensure ourselves similarly we do when it's cold and influenza season. Number 9. Where COVID-19 originated. It's notable that the infection was first found in Wuhan, China, yet it's not completely seen precisely where it began. COVID-19 is likely a zoonotic infection, which implies it tends to be transmitted among creatures and individuals. This has driven analysts to search for creatures that may have initially conveyed the sickness. There are a great deal of similitudes between COVID-19 and two bat-determined strains of beta coronavirus, which implies they are likely related. Since the infections share about 96% of similar qualities, it was at first accepted that bats were the wellspring of the flare-up, which was pinpointed to the Wuhan and seafood market, where colorful creatures are sold. As time went on, and more research was directed, Chinese analysts had the option to establish that COVID-19 shared 99% of a similar hereditary data as a comparable infection that contaminates pangolins. This proposed pangolins may have been a middle person have for the infection, yet the exploration wasn't authoritatively distributed, and a significant part of the examination remains unconfirmed. 4. While deciding the exact cause may assist virologists with bettering comprehend COVID-19, doing so isn't totally important in combating the spread of the illness, since it's been discharged into the human population. 5. Number 8. How COVID-19 is transmitted. Since the primary day the world found out about the Wuhan coronavirus, its dread spreading started to rise. How was it transmitted? And what should be possible to restrict its transmission? Individuals have consistently dreaded Ebola, however that is far harder to get than something like a coronavirus. And it's everything about what it taints and how it is transmitted. COVID-19 causes a respiratory disease, and it's through an individual's breath that it spreads the most straightforward. There are two known methods by which the infection spreads: individual to individual and through contact with contaminated surfaces. In an individual-to-individual circumstance, the infection can be spread through close contact, which is commonly viewed as a separation of 6 feet. The manner in which an individual can pass it on is through respiratory beads, which are created when an individual hacks or wheezes. Covering one's mouth when this happens lightens the spread of the sickness, and contaminated individuals should wear a face mask to diminish the danger of transmitting it to another person. In any case, if you don't mind, regard the Surgeon General's warning. 6. And don't accepting a cover except if you need one. The other way it is spread is through a surface defiled with the infection. A ledge could have been in the pathway of a sniffle, which conveyed COVID-19 to its surface. Contacting that, and afterward contacting your mouth, nose, and perhaps the eyes can bring about disease. Number 7. How COVID-19 is detected or confirmed. There is no known insusceptibility to COVID-19, which implies that everybody is in danger of getting and spreading the disease. That doesn't mean this is an ideal opportunity to freeze, since you may get contaminated. Doesn't mean you're going to fall over dead in a couple of hours. COVID-19 can be perilous. However, like most contaminations, certain bits of the populace are more in danger than others. Small kids, medicinal services experts, the older, and individuals with an undermined safe framework are the ones who are most in danger of getting truly sick from COVID-19. 10. At the point when a solid grown-up gets the infection, there's a likelihood that they won't show any side effects whatsoever, and won't become ill. This is one reason the infection has figured out how to get away from the bounds of Wuhan, China, to taint the world. Tainted individuals who are asymptomatic 11 become obscure bearers. And in any event, when and in any case solid grown-up shows manifestations, they are regularly mellow and similar to the basic virus. Number 6. Who is at risk? There is no known invulnerability to COVID-19, which implies that everybody is in danger of getting and spreading the contamination. That doesn't mean this is an ideal chance to freeze, since you may get tainted. Doesn't mean you're going to fall over dead in a couple of hours. COVID-19 can be hazardous. However, like most contaminations, certain parts of the populace are more in danger than others. Little youngsters, social insurance experts, the older, and individuals with an undermined resistant framework are the ones who are most in danger of getting truly sick from COVID-19. Number 6. What are the symptoms of COVID-19? The initial segment of this square is going to list the side effects related with COVID-19 that shouldn't startle anybody. However, the last piece will be about the more hazardous parts of the infection. Try not to be frightened, as these are the most pessimistic scenario side effects that won't influence the vast majority who are tainted. The most widely recognized side effects of COVID-19 are fever, hacking, and brevity of breath. 12. These are similar manifestations the vast majority get from the basic cold. Yet they are the mildest potential side effects an individual can experience. For the individuals who are under a more prominent arrangement of hazard because of an undermined resistant framework, or meet the standards recently referenced, side effects can become unmistakably increasingly serious. COVID-19 can expand the odds of contracting pneumonia. It can cause numerous organ disappointment. And now and again, it can result in death. 13. These are the most extreme cases, however all are of worry because of the simplicity by which it tends to be transmitted from individual to individual. Number 4. COVID-19 mortality concerns. Truly, COVID-19 can take an individual's life. However, that doesn't mean the world will wind up as it did in Stephen King's The Stand. The death rate for COVID-19 is assessed to be 2.3%, and keeping in mind that that number may appear to be low, it's most certainly not. On the off chance that you look at the death pace of COVID-19 to something progressively regular like this season's flu virus, it's extensively higher. Seasonal influenza has a death pace of 0.1%. which sees a normal of 1 passing for each 1,000 people. 14. These numbers are resolved by means of the case casualty rate, CFR, which analyzes the all-out number of tainted patients with the individuals who surrendered from the disease. While COVID-19 is a lot higher than the flu, it presents as a mellow contamination in by far most of individuals who have had it. Most of individuals who have kicked the bucket in China have been old, and investigations of passings from the infection show that the CFR hops to 14.8% for individuals who are 80 and more established, while those between the ages of 70 and 79 have a CFR of 8%. For individuals who were at that point fundamentally sick when they interacted with the infection, that number bounces to 49%, recommending they're the most helpless individuals from the populace. Number 3. Avoid becoming infected. List first distributed an article on top 10 things you need to do to prepare for the coronavirus. Yet this was proposed to be a greater amount of an apocalypse-type situation. So think about it while taking other factors into consideration. Thank you for watching and subscribe.